Should I start with a little clink?
I like it.
All right. Hey everybody, welcome. This is a brand new video podcast series I'm starting. My name is Megan Cranenberg. I'm a doctor of physical therapy. I own a practice in Poulsbo, Washington called Chrysalis Physical Therapy, and I also happen to be the 51% owner of a brewery with my husband. So a while back I had the idea, hey, let's start a video series where I get to sit down with other providers who work in the field of pelvic health and have just awesome conversations over a pint of something, where we discuss common diagnoses, treatment options that are available to people, and to hopefully just leave the audience with a couple new ideas about what might be going on in your body and where you can find help for that. So again, I'm Megan Cranenberg, physical therapist, and I'd like to introduce you to...
I'm Dr. Josie Ball. I'm a chiropractor, specialize in sports medicine. I'm a certified chiropractic sports physician as well.
Okay.
I've specialized in some pregnancy training in there. I work in a clinic in Gig Harbor, Washington, called Pro Sport and Spine. We do a lot of sports medicine, general holistic health, a lot of family medicine kind of stuff.
Awesome.
In there.
Awesome.
Went to school down in Portland, Oregon, got my master's in sports and exercise science and my doctorate in chiropractic.
Oh, where'd you get your master's?
Same school.
Oh, okay.
Absolutely.
Awesome.
Yep. It was a little crazy few years. Did all of it in 3 years. Master's and doctorate program. I don't know what I was thinking, but we're here. It was
There
fun.
were no kids yet, right?
No kids yet. He just happened a year ago. So.
That's true. How old is Atlas now?
He'll be 14 months at the end of the month.
All right. Oh.
So grows up way too fast.
They do. Mine are 12 and 8 now, so it flies by. And
Absolutely.
when I was in grad school, my daughter was a toddler. I started physical therapy school when she was 15 months old. So
Brave lady.
I just say, you can do it if it's something that you're really passionate about. Just take that opportunity.
Absolutely.
Awesome. So Josie, how did we meet?
So I kept hearing your name around the community. I was like, I gotta meet this Megan girl.
Yeah.
We had both
Talk about yourself.
Right. So we ended up at the Baby Expo. And
the Peninsula Birth and Baby Expo. That was 2 years ago.
Yep.
They didn't do one last year, but it's coming up again in March. So look for it on Facebook and Instagram. Follow that social media. You're gonna be there? We'll both be there, so you can meet us there.
Yep.
Okay, so.
We were there, and I kept looking around the room for you, came and introduced myself, and I was like, we got to chat. We have so many similarities. So.
It was a fun day.
Yes,
I heard of your name too, and I was excited to meet you. We will put a link in the comments on the YouTube video and on Facebook and Instagram. I will link to the Peninsula Birth and Baby Expo site so that if you're interested in learning more about that, you can just go get your tickets and learn more there.
It's a really great resource.
Yes, it is. And another link that I'll put in there is honestly the PeninsulaBirthNetwork.org. PeninsulaBirthNetwork.org. Kind of a one-stop shopping for perinatal providers, whether it be midwives, doulas, chiropractors, physical therapists, massage therapists. Since today the topic that we're going to be talking about is perinatal pain, like pregnancy-related pain. We're not going there yet. It'll be the next segment.
Just wait.
But I want you to have those links now.
Absolutely.
So why are you a chiropractor? Josie, what took you there?
I love the human body and health and movement and just helping people to feel better. For me, I've had on and off back pain since I was 8-9 years old, and my chiropractor was the one that really made a big difference in teaching me how to move better.
Awesome.
Then hooked me up with a physical therapist, and just that conjunction of work has kept me mostly pain-free for the last 10-20 years.
I like to think of, I don't know if there are any other musical theater nerds in the crowd right now, but when I think about chiropractors and physical therapists and kind of, the tribal warfare that can exist sometimes,
Absolutely.
but got got Crystal Fulta in Poulsbo, Smith Chiropractic here in East Bremerton that have great reputations, and I like to think of, there's this musical Oklahoma that's been around since like the 1940s, okay? And there's a song, it's all these cowboys and ranchers, right? There's this whole song that goes, oh, the cowboy and the farmer can be friends, okay? And I was like, oh, the chiro and the PT can be friends. So that kind of segues right into the next part of our conversation. Like, what do you think are the biggest myths, in that sense of like, oh, chiropractic, physical therapist, like, what do you see the myths about chiropractic that you would like to quell right now?
Absolutely. Biggest one is that we only work on backs. I get that people come in and they're like, so who do I go see for my ankle? And I'm like, well, what's going on with it? Like, oh, you can work on my ankle too? Like, absolutely. Like, it's a holistic body approach. We're not just looking at low back pain, neck pain, headaches kind of thing. It's learning how to assess a person's entire system and knowing what our kind of wheelhouse is, the things that we're great at working on. And adjusting is a great tool. It's a cool thing that we have really worked hard at learning to be the best at. Yeah. But it's not everything that we do. It's not just about low back pain. And it's probably the biggest thing I want people to know is ask your chiropractor, like, if you've got something else going on, talk to them about it.
Yeah,
absolutely.
What's happening in the ankle is not necessarily where you feel the pain isn't necessarily where it's coming from, right?
It's that old song that we were taught as kids, the knee bone's connected to the thigh bone, and it's actually true. It's all connected with this stuff. So.
And the ankle and the hip really mirror each other too. So if we're looking at the ankle or any part of the human body with our blinders on, we're not seeing the whole picture.
You can never just assess one area. You've got to look above and below. If there's opportunity to look below.
What about, so some of the things that I was kind of conditioned to kind of thumb my nose a little bit as a, fancy physical therapist are, things like always taking x-rays or that you're going to go to a chiropractor 3 times a week for the rest of your life.
Those are some of the
What are your answers to that?
Absolutely. There are those chiropractors out there. I'm not going to lie.
There are PTs that overuse too.
Exactly. So they're there for reasons. Personally, in our office, I order x-rays when there's clinical indication for it.
Okay.
For me, and the way I kind of explain it to patients, we're like, oh, I don't need to have a full set of spine x-rays done. We're movable beings. Just because you stand on an x-ray and you look like this perfectly, and then they shoot this picture of you, and something shows rotated here, rotated there, one shoulder's hiked up, well, when the x-ray was taken, was your shoulder just twisted up, or are you actually twisted? I mean, you're trying to take a 3 to 4D picture of somebody who moves and is transitional and that sort of thing, and then trying to put it on 2D film, and it just doesn't work that way. So it's there like, hey, you fell down some stairs and your low back really hurts and you got point tenderness over your L4.
That's a red flag, and we want to make sure there's no fracture.
Absolutely. Exactly. So those sort of situations, touching on the whole seeing a chiropractor twice a week for the rest of your life. The way I usually explain this to people is typically that happens when there's not a resolve happening. And I think this is where chiropractic and physical therapy can really meld together most beneficially. Is chiropractic is great with adjusting and some soft tissue work and really getting some movement in there. And if your chiropractor doesn't specialize in doing the rehab side of things or doing that physical medicine that physical therapists are really great at, then you need concurrent care at the same time, because you can get something moving, create that mobility, but unless you have that stability to pattern with it, it's not going to actually fix the problem ultimately.
Yeah, exactly.
And so yes, you're going to need to be adjusted twice a week for the rest of your life in order to feel good, because you're not actually fixing the problem.
You're not correcting the underlying biomechanical issue that's leading to the pain.
Exactly.
And the other thing that's interesting, about imaging in particular, whether it's x-rays or MRIs or CAT scans, and I think we as Americans have really been conditioned to have these like highly technical interventions to find if there's some silver bullet that's going to solve the pain. And point blank, we're just finding that that's an inaccurate way to find the pain. There are a lot of emerging research right now that can pinpoint that if you went into a room, so here we are in a brewery, right? If it's a busy night, if we got about 60 or 70 people here in the brewery and we said, hey, everybody in here, we want to take you back and x-ray your low back. And then later we ask those people, who has back pain? The people raising their hand to have back pain and the people who showed abnormal findings on the x-ray or the MRI are going to have no correlation.
Yeah, I think that study I was reading was like 80% of the population has some sort of abnormal finding on their imaging. Usually between 40 and 60% of them even have some sort of symptom that correlates with that. So half the time it doesn't even matter.
Right? Because guess what? Our bodies are machines, right? They're going to have wear and tear. Absolutely. I just turned 40. I've got some gray hair. it's as normal for me to have some lumbar spine degeneration on an x-ray show up for me as it is to start wondering if I need to go to the salon more often, you know? Or our skin changes texture. There are things that just come along with being a human being in the world, experiencing the forces of the world that are going to change. So I think that's a myth that doesn't just permeate kind of the chiropractic world, but really the world of pain in your body. And that's a whole, we could just have a whole another podcast talking about pain science and the biopsychosocial model of care that is truly, truly important. And, you know, myths for physical therapy, I would say, are that, you know, again, that we only treat like certain conditions. It's like, oh, you only do like knees and backs, and I go to you after a sports injury. And so every week I get people into my clinic that are new public health clients going, really, there's physical therapy for my constipation, for my incontinence? There's physical therapy for endometriosis? And you're like, yeah, it's been here for like 40 years. We've been doing this. And so, but that's why we're here. We're getting that message out. Or the myths of like, yeah, I went to PT, it didn't really help. I just laid on a table and did the same 3 or 4 exercises, 10 sets, 3 sets of 10, while the PT was off in the corner drinking coffee, watching the football game on the TV. And those same clinics are out there with PT too. So, you know, if there's one thing that I want people to know about both of us, is find a provider that's listening to you and looking at you as an individual, and has enough tools in their toolkit that can approach your unique set of symptoms with a diversity of their approach and with more than just 1 or 2 things.
Absolutely. I mean, adjusting is a great tool. Soft tissue work's a great tool. Exercise, nutrition, all these pieces are wonderful tools until you find providers like ourselves that encompass those and pull those all together and go, okay, this is out of my wheelhouse. I need Megan's help. And we can
counseling. Pain is traumatic. Sometimes it's counseling too.
Just that holistic approach is super important.
Super important. I love it.